So the basic clinical exam for thoracic outlet is going to start in a standing position where we're just going to do a visual assessment. And here we can get an idea if we have any fullness in the supraclavicular space that might indicate an elevated rib. We can just look at his resting position of his shoulder and scapula, and we'll be evaluating that and scapulohumeral rhythm toward the end of the basic clinical exam. So we're going to start with doing a cervical screen. So I'm just going to ask him to bring his chin down to his chest. Good, and come back up. Then I'm going to ask you to open your mouth and look up. Good, and come back, looking and listening if they have any provocation of their symptoms, which would indicate a cervical issue. Go ahead and look to your right, here, and your left. If they have a limit, go ahead and come back with rotation. Sometimes you'll note that that's because the rib is elevated. So if they have a limit there, that's something I keep in mind, and then I'll test that later when I look at the cervical rotation lateral flexion test as well as first rib testing. So now I'm going to have him side bend, so go ahead and bring your ear down to your shoulder. Good, and come back, as well as the opposite direction. Good. Okay, now what I'm going to have you do is I'm going to have you sit down, okay, here, and I'm going to perform the Spurling's test, and we're going to do this in two parts. So I always start on the uninvolved side, so I'm going to come in, I use my fingertips, I come back, go into extension and side bending, and I wait. If there are no symptoms, I'm going to give some downward pressure. Okay, doing okay? Mm-hmm. Now I'm going to look at his involved side. I'm going to come back into extension and side bending, so part one of the Spurling's test, and then part two, adding that downward compression. Okay, good. Okay, now we're going to do our elevated arm stress test. So I'm going to come up here. Good. 90 degrees of shoulder abduction, 90 degrees of elbow flexion. Coming in, I'm going to have you open and close for me 1 time per second. So we'll be doing this for 60 seconds, looking for reproduction of the patient's symptoms. Okay, good. And come on back. Then I'm going to grab some pillows, and then I'm going to be doing the Cyriax release test. So I'm going to prop his arms up here. And again, I can either go from the lateral aspect of his elbows and come up and hold, or I can go from his scapula. I'm going to go from the elbows here. Come on up, relax for me. I'm going to hold that for 60 seconds. I'm going to give you a more neutral position. There you go. Perfect. And listening for reproduction of symptoms and watching the clock to see if that provokes any symptoms. So that's the Cyriax release test. Good. Okay, and now I can take these out here, and I'm going to come in and do the supraclavicular pressure test. So I'm going to come in just superior to the clavicle and lateral to the sternocleidomastoid. So I'm right over the scalene triangle, over the brachial plexus. I'm going to squeeze and hold that for 30 seconds. Let me know if you have any symptoms that reproduces any symptoms. Following the supraclavicular pressure test, we're going to do the costoclavicular maneuver. So what we're going to do there is I'm going to have him retract and depress his scapula. So bring your sternum out like you're sticking out your chest, and then I'm going to hold there, and I'm looking to see, do we have an obliteration of his radial pulse or reproduction of symptoms? So we're going to hold that for a minute. Good, and come on back. And then we're going to do the Wright's test, so go ahead and relax. So the Wright's test, I'm going to again find his radial pulse coming up into an abducted position, holding this for 1 to 2 minutes, looking for an obliteration of his radial pulse or reproduction of his symptoms. Good. Doing okay? Mm-hmm. Good. Then I'm going to come back. And now we're going to assess his first rib. So we're going to do the cervical rotation lateral flexion test. So what I'm going to do first, I'm going to test his uninvolved side. My left elbow is going to be in front. I'm going to perform contralateral rotation with ipsilateral side bending. So I'm going to come in, go to the end of the range, and then I'm going to side bend. I'm looking at excursion and end feel. If the rib is in appropriate position, it should not block that side bending motion. If the rib is elevated a little bit, I'm going to feel a limit and decreased excursion. So now I'm going to come to the right here. I'm going to rotate to the left and side bend. Good. And back. Then I'm going to follow up with my spring test at the first rib. So I'm going to come down from the mastoid here. I'm going to come in. I'm going to give a little bit of overpressure here, going toward the opposite hip. So this is assessing the costovertebral joint to the first rib. When it's more limited, I'll see more of his body moving, and I'll have a harder end field. Then I'm going to have you go ahead and stand up. I'm going to move this out of the way. And now we're going to go through our active neurodynamic tests. So I'm going to have him come up, and we'll do the uninvolved side first. And I'm just going to have you bring your hand all the way up here for median nerve. And I'm going to have you side bend away. Okay, I'm going to actually have you tip your ear toward your shoulder. Perfect. Any symptoms there? And then let's try the other side. So go ahead and bring your arm up for me, and then side bend away. Okay, and straighten your elbow fully if you can. There you go. Good. And come on back. Good. And come back down. Now we're going to look at the radial nerve. So the radial nerve, you're going to bring your thumb in your palm. Let's do the left side first. You're going to bring your palm down, and you're going to come up and come up into abduction. Perfect. And then tip your head to the side. Any problem with that?
No.
Good. And come on back. And let's do that same thing over here. So thumb in your palm, palm down, and bring it all up to about 80 degrees, and then tip your head to the side. That's for radial nerve, upper limb neurodynamic 2. And then the upper limb neurodynamic 3 for the ulnar nerve is I'm going to have you come in. You're going to make a little O with your thumb and index finger and come up here. Good. Any problem with that? Good. And back. And then how about the other side? That one's a little tricky. That, I think he's got some shoulder things there. Good. And come on back. Okay. So now what we're going to take a look at is his resting position of his scapula and his shoulder. And here's where I'm going to have you turn around. So we're going to look at his resting scapular position. So we're going to find normally the superior angle should be at the level of T2 and the inferior angle T6 or T7. So I'm going to come in and find my T2. Here I think is C7. I'm going to confirm that. My index finger is going the spinous process of C6. Go ahead and look up for me. Here it translates away. I know I'm on C6, C7, T1, and T2. And looking across, so I find his superior angle. They should line up to T2, and then I'm going to palpate along the border, the medial border of his scapula, and the inferior angle. What I'm looking at is his scapula resting in neutral, or is it more downwardly rotated where the medial border, the inferior angle, is closer than the superior angle. I'm also going to take a look from the side, and I'm going to just assess if this is, I find here is his anterior and posterior acromion. Here's his humeral head. I look at where his humeral head is resting in relation to the acromion. It should be normally a third of the width. If it's more than that, like I see here, now I'm thinking I may have some posterior superior capsular tightness. Okay, so let's see here. We see it quite a bit forward. And let's take a look at the other side here. And here looks great. So alignment-wise here looks good. So I think in my head I'm going to be doing some testing for the posterior superior capsule in a little bit. Okay, so now I'm going to look at his dynamic control. So I'm going to have you raise your arms up first in flexion. Go ahead and come on up. Good. I'm looking at, does his inferior angle meet his mid-axillary line? And I look at the amount of creases that occur at the AC joint. Go ahead and come on back. We want to get optimally, go ahead and come up again, optimal scapular elevation. And if he's staying more depressed, we'll see deep creases at the AC joint. And come on back. Now I'm going to have you come out to the side. So coming out to the side for me here. Good. Nice. So he meets the mid-axillary line. We're getting appropriate upward rotation with elevation. Come on back, and one more time. And then I'm going to have you stay in that position. Good. Okay. Come on back. And we're going to take a look at that posterior superior capsular mobility. So I'm going to have you first reach behind your back with your left arm and go ahead and go up as high as you can. Good. And now let's check the other side. So we can see already that compensatory motion on that involved side. Good. So I'm going to now test. So I'm going to come in and I want you to relax. This is a passive test. I keep him adducted and I'm going to go into further internal rotation. Good. And the other side here. Now, as soon as I adduct him, you can see what his scapula is doing. So we already see we have some tightness here. Relax for me. And I feel like his arm is more glued to his back, so he's got some posterior superior capsular tightness. Go ahead and turn around for me here. And now I'm going to do something called the clavicular mobility test. So what that involves is I'm going to place my small finger just above the clavicle in that supraclavicular space. I'm going to elevate his arm to 45, and I should feel normally that clavicle should move and give my finger a little more space. If it doesn't, that tells me the clavicle's moving too early and it's going to push me out. And that would indicate, with some extra testing, some joint-specific testing, to look at the SC and AC. So I come in here and come up. And again, I should feel a nice little space open up. And my last one is I'm going to turn around here. Good. And now I'm going to do a screening for the cervicothoracic junction. So I'm going to have you bring both arms up overhead. Okay, and we're going to look at the left arm first. I'm going to have you drop down one, and I want to see, without cheating with your trunk, can you raise your arm up a little further? So that's going to assess that mobility with rotation and extension at end range at the cervicothoracic junction. Good. And now let's see the other side. So bring both arms up again. Drop down here. And can you go a little further? This one's a little bit stiffer. So that's where our joint-specific tests come into play. Looking at, go ahead and come back, looking at the mobility both with our upper ribs here, our costotransverse joints, our rotation and extension. And this completes the basic clinical exam for thoracic outlet.